Hi everybody. Welcome to NUR 113's lecture on Individual Module 4, the concept of sexuality. And specifically in today's lecture, we're going to be talking about family planning, preconception counseling, and contraception. We'll be talking about responsible sexual behavior and sexually transmitted diseases. You'll find your learning outcomes listed on this slide, and you can read over those. But let's get right into it. We're going to start talking initially about family planning and preconception counseling. And why do we care about this? Why family planning? Having a family is a major decision for most couples, and it helps to ensure that their decision is an informed one. So the question is, do we conceive or do we not conceive? And the purpose of family planning is to help them achieve whatever their desired result may be. Think back to one of our first couple of lectures where we talked about the developmental stages of a family. So in this particular area of family planning, we are talking about a couple who is deciding whether or not to move on to that next developmental stage in the world of a family, whether or not they want to have a baby. And family planning can help them to either get on birth control so that they prevent pregnancy, or it can help them conceive by helping to let them know how is the best way to do that. In comparison with family planning, why do we care about preconception counseling? Well, family planning focuses on whether or not you want to have a family. And preconception counseling is for those individuals who've decided that they want to conceive, and we're trying to help them conceive a baby and have the best outcome possible. We want to achieve the best possible health state for the mother and the fetus. We want them to achieve a desired outcome of that pregnancy, so we don't want any perinatal loss. We might need to help resolve some decisional conflicts between the couple. Where they're going to deliver, how many children they want, what's the best way to go about it. And we want to help ensure that the pregnancy is healthy, that it's viable, and we want to provide options to the couples that they may or may not realize they have or don't have. So in regards to that, we're thinking about couples who may have some genetic problems in their past or in their family history, or couples who are struggling with infertility. So we may have to put them in touch with some different types of options that will help them along the way to achieve whatever their desired outcome is. So let's talk a little bit about health promotion measures. We've talked a lot lately in the first 3 lectures about health promotion, and there's nothing any different with health promotion when it comes to preconception counseling. We want the healthiest outcome for mom and baby. So we want to educate couples on the health risks that might have a negative impact on a pregnancy. If the mom or dad smokes, we want them to stop. We need to teach moms to limit their intake of caffeine. That substance abuse is not cool when you're pregnant, or anytime really. And that there are particular over-the-counter drugs that might harm the baby as well. So it's important for people to know these things prior to getting pregnant or while they're trying to get pregnant so that they don't experience any adverse outcomes. We need to identify chronic health issues for mothers, and we need to refer them to specialists. So, people who have endocrinology issues, they have issues with their thyroid. Pregnancy really does a number on your hormones, and it can affect all kinds of things related to your different body systems. And we need to refer those people to a specialist who can help adjust their medications and follow them closely through the pregnancy so we achieve a desired outcome. And we also want to identify environmental hazards that might be of risk. If you think back to last lecture, um, where we talked about perinatal loss and risk factors, I mentioned an illness called toxoplasmosis and how we ask pregnant women whether or not they have cats in the home or if they handle cat litter. Well, that could be an environmental hazard that might give them a negative outcome that we would want to be aware of and teach them about so we can promote healthy outcomes. So moving on, we have to do a physical exam on these people whenever we're doing preconception counseling. Both partners need to be examined. We need to identify health problems and illnesses so that we can take care of those things right up front. We need to obtain a thorough history. We want to know about any genetic abnormalities, any chromosomal abnormalities in the past. Or let's say, for example, we have a history of sickle cell in the family. Those are all things that we want to be aware of. Both partners potentially may need to be, mom for sure needs to have lab testing done, but possibly we may need to do that for dad, especially if they're struggling with infertility, because the first thing that we want to rule out if they're struggling with infertility is that the dad is not sterile. If there are genetic issues in their history, then we may need to refer them to a specialist so that they can get some genetic counseling. Nutrition is a very big whenever you are doing health promotion preconceptually. It's important that moms maintain a healthy weight. It's important that their diet can contain lots of folic acid for neural tube development so that they don't end up with neural tube defects. Vitamins are very important. And there are cultural considerations too, nutritionally. We have to also be cognizant of that and be sensitive to those needs. It's important that they exercise. Ideally, they should have established a exercise routine prior to becoming pregnant. But we want to encourage them to continue that because we don't want them to gain too much weight. That can also have an adverse result for the baby as well. Immunizations need to be up to date, but remember when we talked about types of vaccines that we said pregnant women cannot receive live vaccines, and it's important to know that because one thing that we test mothers for lab-wise is is how well they are immunized against measles, mumps, and rubella. That's another one of those vaccines that sometimes often require a booster. So we check their titer level prenatally, and if they are non-immune to MMR, then that is a vaccine that we offer them immediately after they deliver. But it cannot be given to them during pregnancy because it's a live vaccine. If possible, any vaccines that they need to have, we want them to get those 3 months prior to conceiving. And as always, we want everyone to receive the flu, and, pregnant women can receive the flu, they just cannot get the mist. Another big one for pregnant women these days is the Tdap vaccine, which vaccinates specifically against pertussis, is the portion of that vaccine that we're worried about for pregnant women. Moving on to infertility. So what is it? Infertility is a lack of conception despite unprotected sex for at least 1 year. So you've got to have a couple who has been trying to get pregnant for at least 1 year, and if they lack conception, then we can deem them infertile. Subfertility means that both partners have reduced fertility, which makes it very difficult to conceive. So the mom has less eggs than a normal person, and the dad would have less sperm. Secondary infertility occurs when a couple cannot conceive after successful pregnancies. So we have a mom and dad who have had children, and now they're trying to conceive, but they can't. So what are risks for infertility? Well, let's focus on the man. Alcohol abuse, substance abuse, smoking, certain types of prescription drugs, teratogen exposure, and cancer treatment. When we think of cancer treatment, we think of like testicular cancer. All of those things are risks for male infertility. For females, it has to do with age. The older you are, the more at risk of being infertile that you are. Alcohol use, there's smoking again. Stress plays a big role on hormones and can greatly hinder becoming pregnant. Poor diet, someone who is gravely underweight or grossly overweight. People who have tons of athletic training, and that relates back to not having quite enough body fat and hormones being sort of out of whack from what a normal female's hormones would be. So these people probably don't ovulate. And then sexually transmitted infections also can make someone infertile. There are a few boxes and tables listed here for you to look at and know. There are some components necessary for normal fertility listed on page 1373 in your Pearson book. It's box 19.3. And then there are some possible causes of infertility on page 1373 in table 19-4. It is important for you to look over those. Young couples that have no history of reproductive disorders who cannot conceive after 1 year of trying really need to be referred to someone who can evaluate them for infertility. And like I said, mainly that process starts with ruling out the male. They'll have him submit a sperm sample, they will test it, and if he is fertile, then they will move on with testing from a female standpoint. And usually that starts with lab work. Oh my, this PowerPoint has sounds. All right, let's move into contraceptives. Here are your learning objectives. I meant to remove those noises. All right, there are several different methods of contraception, and here are some listed out for you. There are chemical methods, such as birth control pills. There are natural methods, such as breastfeeding. There are barrier methods, such as condoms. Implantable devices, such as the Mirena device, intrauterine devices or IUDs. There are also little rods that you can insert under the arm. There are surgical methods and an emergency method. So let's talk about chemical methods. So these will be your birth control pills and shots. The first one we're going to talk about is Depo-Provera. These shots have to be given by a healthcare provider. It's an intramuscular injection and it's given every 3 months. And this stops your ovaries from releasing their eggs. It thickens cervical mucus. It does not interfere with sexual intercourse, and it is safe to use while breastfeeding because it is a progesterone only form of birth control. Thickening the cervical mucus is important in birth control because the thicker your cervical mucus is, the more difficult it is for a sperm to get through that and find an egg. So what are some disadvantages of the Depo shot? It cannot be used more than 2 years. Well, it should not be used more than 2 years because it can cause a temporary loss in bone density, and that is due to the progesterone in the shot. It may cause bleeding between periods. It can cause weight gain and headaches. Weight gain is probably the most common complaint that you hear in regards to the Depo shot. And oftentimes people will go on it, gain their weight, and then not come back for the 3-month follow-up shot because they've gained weight. And if that's the case, we need to contact those individuals so that we can get them on some other form of birth control if they are still planning to want to not conceive. Also, with the Depo shot, you may not be able to get pregnant for several months after you stop the shot because your body kind of has to normalize its hormones. All right, let's move into oral contraceptives, or what everybody calls the pill. With the pill, it's got to be taken every day, and preferably it needs to be taken around the same time every day because what we're doing is trying to control hormones. The pill prevents ovulation, and if it's taken correctly, it's 92 to 99% effective. It has to be prescribed by a healthcare provider, and there are many, 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 many different types of the pill, and your physician or the nurse can help you determine what is probably the best type of pill for you to go with. I want you to look at page 1384 in Pearson, table 19.6, and review the side effects of oral contraceptives. When we're talking about the different types of the pill, there are combined pills and there are progestin-only pills. And combined pills work by inhibiting an ovum release. It creates an atrophic endometrium, which means that it does not allow the endometrial lining of the uterus to lend itself favorably to implantation by a fertilized egg. It helps maintain thick cervical mucus. There are 21 pills with hormones, and there are 7 pills that are placebo pills when we're talking about combined pills. And there are also ones that are considered low dose pills, meaning that the hormone level contained in those pills are lower than other types of birth controls. And it's important to know that those low dose pills may be a little less effective. The progestin only pills are sometimes called mini pills, and they are used by nursing mothers. If you are a breastfeeding mom, this is the kind of pill that you have to be on, a progestin-only pill. Oftentimes, you'll hear it called Micronor or the mini pill. There are some disadvantages to this progestin-only pill, and it can cause irregular bleeding, an increase in appetite, therefore weight gain, a decreased sex drive or libido, and it can also cause ovarian cysts. Well, let's talk about disadvantages of the birth control pill in general. There are several disadvantages in taking the birth control pill because it is only as effective as it says it is if it is taken as it's prescribed. And oftentimes it is very difficult, especially for adolescents, to take a pill at the same time every day. After being off of the pill, it can take a few months for a woman to get pregnant because her hormone levels have to sort of normalize again, and her body has to learn how to release that egg again. After discontinuing the use, multiple pregnancies are more likely, and that may be an unintended outcome for someone who wants to get pregnant but has been on the birth control pill for a long time. And again, that has to do with hormones and how your body releases an egg. Another huge disadvantage of the birth control pill is that all of them carry a risk of causing heart attack, stroke, and blood clots. So it's very important that you educate your patients the danger signs of these things. So chest pain, shortness of breath, severe headaches, etc. There are also contraindications for taking the birth control pill, and those are increased blood pressure, a history of blood clots, and if your patient is a smoker. Smokers are already at a big risk for blood clots, heart attacks, and strokes, right? So if they're a smoker, we don't particularly want them taking an oral birth control pill. It increases the risk that they will have one of those three things even greater. You can also go to page 1384 and review the ACHES acronym, ACHES. All right, moving away to other types of birth control. So the patch used to be a popular method whenever I was in high school. They had just come out with the patch and everybody thought it was so easy. And the effectiveness of the patch was 92 to 99% effective if you used it appropriately. And it was worn for 1 week somewhere on your body, your abdomen, your buttocks, or your upper body. And it prevented your ovaries from releasing eggs. It thickened cervical mucus and it thinned out the uterine lining. So that's the atrophic endometrium that we talked about a couple of slides ago. This has to be replaced once a week for 3 weeks of the month. And then there's 1 week in the month where you don't wear one, and then you have your cycle on that week. Oftentimes people wore this on the upper outer arm, just like a nicotine patch. So what are some disadvantages of the patch? Well, it required a prescription, but you know, all birth controls pretty much do. It carried a risk of blood clots, heart attack, and stroke, just like most birth controls do. And it could also cause nausea and vomiting. It could cause bleeding between periods and breast tenderness, and that all had to do with hormones. Vaginal rings were also are also a form of birth control, and it is basically a little plastic ring that has hormones in it, and it is inserted into the vagina up next to the cervix. Um, it is 92 to 99% effective. The most popular version of vaginal ring is called the Nuva ring, and it releases hormones once it's inserted, and it prevents pregnancy. It's worn for 3 weeks out of the month, and then on that fourth week, you take it out and have your cycle. Disadvantages of the ring is that it can very well become displaced. It can cause swelling in the vagina, it can cause irritation or a vaginal discharge. Um, so those are some things to consider whenever educating your patient on different types of birth control. All right, let's move on to natural methods of contraception. Well, first and foremost, how about abstinence? That's what we teach in high school pretty much. Um, and definitely, this is a natural way to not get pregnant. This is defined as not having any intercourse or sexual play with a partner. Only birth control method that is 100% effective is abstinence. So remember that, especially when you're educating your clients. There are also there's also another natural method that is also termed a situational contraception, and this is called the withdrawal method. And yes, this is actually a form of contraception that is recognized. It completely relies on self-control by the male. And what this means is that it's a behavioral reaction where a man pulls his penis out of the vagina before he ejaculates. However, this is the least effective method of birth control there probably ever has been. 4 in 100 women will become pregnant even if this is done correctly, and it is definitely not recommended for the inexperienced person. So, for all of those little adolescent boys who think pulling out is going to work, uh, they are sadly mistaken. There's another term for this also, which is called coitus interruptus, if you hear that term. And like I said, this is the oldest and the least reliable method of birth control. So why is it so ineffective? Well, here's why. Pre-ejaculate can contain at least 300,000 sperm, and that's a whole lot. So even prior to ejaculating, you have 300,000 sperm that are already there, and they have the ability to find an egg. Okay, let's move back to disadvantages of the withdrawal for a second. So we said that this is also it's a natural contraceptive method, but it's also termed situational contraception. So it's a situation you're in, and you have to do what you can, right? Another situational contraceptive method are spermicides, and they're inserted into the vagina, and they kill sperm prior to intercourse. So if you have a patient who chooses to use spermicides as their contraceptive method of choice, then the nurse needs to teach that patient that we insert those spermicides high up into the vagina and that they need to lay down supine for at least 30 minutes. That will give them the best result possible to not get pregnant. All right, moving on to fertility awareness. This is basically like the calendar method. So it's 75 to 97% effective, depends on how good you are and how well you know your body. It's not very reliable and it involves meticulous effort and record keeping on the part of the woman. It involves monitoring and determining when ovulation will occur. And the woman has to refrain from sex for 7 days before and at least 2 days after when she thinks she has ovulated. So it requires her to, number one, know when she's going to ovulate, and it requires her to be pretty consistent cycle-wise. If you look on page 1378 in your Pearson book, figure 19-17, you'll see a basal body temperature chart there, and I'd like for you guys to look over that. Basal body temperature is a way that one way that women can determine when they're fertile. And what they have to do is they have to take their temperature at the same time every day, preferably in the morning prior to ever getting out of bed, and they log that temperature. And what happens is a woman's temperature will rise after they ovulate due to progesterone increases in the second half of their cycle. So once they track that rise in temperature, they know that they're fertile and they can abstain from sex 3 days after that temperature rise, along with the day that it rises as well. Problem is that your temperature doesn't usually rise a whole degree. It might just be tenths of a degree. So you have to be very careful when you use this method, and you have to do it exactly right. The calendar method is the least reliable method, and it is based on the theory that ovulation occurs 14 days prior to the next period, plus or minus 2 days. And if you know that and your cycle is consistent, then you can determine which day every month you theoretically will ovulate, and then you can refrain from sex. And believe it or not, here is another form of natural contraception, and this is called outer course. This is sexual play without vaginal penetration. It includes kissing, masturbation, fantasy, oral and anal sex. And it is only effective if the sperm doesn't come in contact with the vagina. And this does not offer protection against sexually transmitted infections. So for our last natural method that we're going to talk about, this is called continuous breastfeeding, or the lactation amenorrhea method. And amenorrhea means no period. This can postpone ovulation for up to 6 months after giving birth. And it works well because the hormone required to stimulate milk production actually prevents the release of the hormone that triggers ovulation. So moms can use this method to prevent getting pregnant directly after giving birth. However, They have to be very meticulous about breastfeeding. It does not work or is not effective if you supplement. You have to be an exclusive breastfeeder, and you have to breastfeed for at least up to 8 times a day. So you really should not rely on this method for more than 6 months, or if the woman starts to have a period prior to that 6 month period. Because if she is starting to have a period, then that means that she's ovulating. So here you go. It's only effective if the woman feeds her baby 6 times a day with both breasts, and does not substitute other foods for breast milk, and feeds her baby every 4 hours during the day and every 6 hours at night. So that's a pretty regimented schedule to have to stick to if you're going to rely on this natural method of contraception. Moving on to implantable devices. The Mirena. This is probably one of the most popular implantable intrauterine devices that there is. It can be placed in the uterus at the OBGYN office in a super quick procedure. And what the Mirena does is it prevents the sperm from reaching the egg, and it thickens cervical mucus. It's effective for up to 5 years. So a lot of women like this because they can have it inserted. It does have hormones in it, but they can have it inserted, and they're taken care of contraceptively for at least 5 years, and they don't have to worry about taking a pill or putting on a patch or inserting a ring. Um, and this is really good for people who only have one partner, because this doesn't protect against sexually transmitted infections. So then you don't have to worry about barrier methods either. Another one is called the Paragard, and this is an intrauterine device, or an IUD, that's effective for up to 10 years. This is a hormone-free birth control method. And this can also easily be reversed in a simple procedure at the doctor's office. And I'm not totally sure about this, but normally the hormone-free birth controls, or IUDs, are made of copper, I believe. And I think that is what provides that contraceptive protection. But don't quote me on that. I'm not completely positive. So what are the disadvantages of IUDs? A lot of people have cramping or bleeding in between their periods. If it gets infected, they can end up with pelvic inflammatory disease, which can cause other issues. Some people can end up infertile, or it can migrate, and they might end up with a tear or a hole in their uterus, which is a whole nother terrible issue. Hormonal IUDs, such as the Mirena, can also cause changes in moods, or it can have increased side effects as well. The Implanon are these little rods that are placed under the surface of the skin through a small incision. Nurse practitioners can do this, ones that are trained, and your OBGYN can do this also in the office. Usually they're placed on the inner side of the upper arm. It contains a progestin hormone that prevents ovulation. So it stops the ovaries from releasing an egg every month, and it thickens the cervical mucus. And this one is effective for 3 years, and then it has to be taken out, and you have to have another one put back in. And that's a blurry picture, but that's what it looks like. Almost like a little matchstick is about the size of it. So what are the disadvantages of Implanon? It's contraindicated in women who have liver disease, breast cancer, or blood clots, and that is because of the hormone. It can also cause acne, weight gain, mood changes, sore breasts, or changes in your period. and it's pretty expensive. It costs somewhere between $400 and $800 to put in up front, and it's about $75 to $150 for removal. All right, moving on to barrier methods. The first barrier method that you think of when you think of contraception are condoms, of course, because you can get them anywhere. Um, when condoms are used effectively, it helps to prevent pregnancy somewhere between 85 and 98%. They are available for both men and women, and they provide some protection against sexually transmitted infections if they're used properly. Female condoms are placed inside of a woman's vagina. They can be inserted up to 8 hours before sexual intercourse, but they are not reusable. You have to have a new one every time, and it is contraindicated if the male is using a condom. So you can't double up, doesn't work. And here is a picture of what a female condom looks like. Very rarely does anyone want to use a female condom because they are awkward to put in, and nobody wants to wear that thing around for 8 hours. So what about a male condom? Well, these are the most easy to use because they are easily applied. They can be applied directly before intercourse. They have to be put onto an erect penis, and they do offer some protection against sexually transmitted infections, and I guess it's a positive that they come in a variety of flavors, sizes, and styles. But what are some disadvantages? Well, condoms can break, or they may not be effective if they don't properly fit. Everybody thinks they need the big size. The woman can be allergic to latex condoms, or they can cause irritation to a male. So people who have latex allergies, this is not a good option for you. And the other thing is that you got to be attentive to storage means and expiration dates when you're talking about condoms. Everybody knows that little boy in high school who carries condoms around in his wallet just in case, and he may not ever find a case, but if his little condom has been in his wallet and he's been sitting on it for the past 2 years, it's probably not a good one to use. So what about the contraceptive sponge? This is a thing, and it's not very effective, 71 to 82%. It's made of a plastic foam, and it contains spermicide in it. It's inserted into the vagina before intercourse. It's convenient, they say, because it's in a small size. Doesn't seem convenient to me. But it can be inserted and worn for up to 30 hours after you put it in. I guess maybe that's why it's convenient, because you can wear it for a while just in case. However, it can cause irritation and allergic reactions. It could be hard to take out, and it might cause toxic shock syndrome if it's left in too long. It's more effective in women who have never given birth, because once a woman has a baby, the birth canal and the vaginal canal change significantly. So, I don't know, I guess it might fall out. And what about the diaphragm? That is 84 to 94% effective. One of the disadvantages of the diaphragm is that you have to be fitted at the doctor's office to ensure that it's going to be effective. You have to have a proper fit. It's usually used with a spermicide, and it can be put in 6 hours before sex, but it has to stay in for at least 6 hours after sex, to make sure there are no little sperm that get up in there. People who are not a good candidate for the diaphragm are people who have a history of toxic shock syndrome. Um, these people cannot use a diaphragm if they have a history of that. But what are the disadvantages? Well, it's got to be left in for 6 hours after intercourse. Also, some women complain that it's very difficult to insert and remove. And there again, it can cause irritation, toxic shock syndrome if it's left in too long, and it could also cause some urinary tract infections as well with insertion and removal. The cervical cap is also another barrier method. It fits over the opening of the cervix, blocking the sperm entrance. You can use this with a spermicide to increase its efficiency. It lasts for up to 2 years, and 14 in 100 women will become pregnant every year if they have one of these. So what are the disadvantages of cervical caps? These cannot be used during your period. It's possible for them to be pushed out of place during intercourse, so that would be a total failure. And they can be very difficult for some women to insert because it has to go directly over the cervix for it to work. And it can also cause irritation and allergic reactions, and it can also cause abnormal pap smear results. So if you have a woman who has abnormal pap smear results or is coming in for a pap smear, it's good to ask if her form of contraception is a cervical cap so that you know whether or not those pap smear results could be affected by her use of that. Moving on to surgical methods. So how do we prevent pregnancy by surgical methods? Well, what everybody thinks of is tubal ligation. And this is something, a surgical procedure that a woman can get in which her fallopian tubes are clipped and tied. And also some physicians decide to burn them, and some people burn them, clip them, and tie them. And here's a little picture. So what happens is you can do this laparoscopically, or you can do it in an open procedure. A lot of individuals who have a C-section who are ready for some permanent birth control often get this done at the same time as they have a C-section. But you can see in this picture that those fallopian tubes have been cut and tied off on both ends with a little suture. And this just prevents the sperm from getting out and finding an egg. And it also prevents the egg from getting in. But some disadvantages in relation to tubal ligation are that it takes longer than male sterilization to recover, believe it or not. It normally costs somewhere between $1,500 and $6,000 depending on where you go. It requires anesthesia, which is another added cost and another risk for the woman. If you want to reverse this, it is very costly and it's not always successful. Pain, bleeding, and complications from surgery may occur, so it could, the surgical site can become infected. You could end up with a uterine puncture, and tubal pregnancies also can occur. The other surgical method that will help prevent pregnancy is the vasectomy. This is performed on the male. It is a very minor surgery, believe it or not, in which the vas deferens, or the tubes through which sperm travel, are cut and they're blocked. This is safer than tubal ligation. and it's much cheaper, and it costs somewhere between $350 and $1,000 and can be done in the office. Um, the sperm stays in the male's system after a vasectomy for 3 months after surgery. Um, and this does not interfere with his ability to have sex or even enjoy it. A very key education point whenever we talk about vasectomies is that the men and women both need to know that they need to use protection until that man has a final sperm analysis series, and that sperm analysis series has been completed and there are no more sperm in his ejaculate. Because even though he's had the vasectomy, if the sperm stays in his system for 3 months after the surgery, the woman can potentially become pregnant within that 3 months. So that's an important educational thing to relay. And lastly, we have emergency methods when we talk about birth control. The morning after pill is the one that you hear of um, most these days. Used to, you had to have a prescription for the morning after pill, but now that's not really the case anymore. You can go to the pharmacy and ask for it, and they are even putting morning after pills in vending machines across college campuses. In different places in the country. So this is a readily available form of birth control. It consists of 2 doses of hormonal pills, and you take those 12 hours apart. It stops the ovaries from releasing an egg, and it keeps the sperm from reaching the egg. For the best results, you have to start it as soon as possible. So within 72 hours of having unprotected sex, you have to get this and start it for it to be successful. The disadvantages is that it can cause upset stomach, vomiting, stomach pain, fatigue, and headache. And that's just due to the hormones included in it. All right. We are going to move on to responsible sexual behavior and try to close out this lecture here within the next few minutes. Here are your learning outcomes for responsible sexual behavior. So, what can we teach in regards to safer sex practices? Well, we have to reduce the number of partners. Have no unprotected sex. So we want to educate people to use condoms or spermicides and to do that appropriately and with every encounter they have. We want mutual HIV testing to be done prior to having intercourse with someone, and take necessary steps if that partner, one or both, are HIV positive. There's a box on page 1407, box 19.9, that talks about guidelines for safer sex, and you can look at that. Another thing that we talk about whenever we think of safer sex practices is dating violence. And this has become a really big issue in the adolescent community, teenagers, college students as well. It's a type of intimate partner abuse, and it occurs with dating youth. So who's at risk? And it's mostly female youth. Mostly African American girls are at a greatest risk for intimate partner abuse or dating violence. These individuals report feelings of sadness. You might see them attempt suicide. You might see them abuse substances. Oftentimes they have early sexual activity. They have an increased number of sexual partners. They don't readily use birth control.